If you care, like, comment, and hit the red subscribe button. I'm Dr. Vicentin, and you've been lied to about lower back pain. That's why your back still hurts. And if you give up some old ideas and stop doing some antiquated treatments, you could heal naturally, and you're supposed to. This number one old idea that's holding you back may be, well, you just have to learn to live with it. What a load of crap. That is not true. The body heals itself. It's a self-healing system. You don't have to learn to live with it. Idea number two, use a heating pad. Like that's going to help. Throw that away. That is old technology. Putting electrical coils next to the spinal cord is insane. Stop that. And if your back is achy or stiff, jump into a hot bathtub and just soak. That's a good way to get rid of achy, stiff pain. Or a hot shower can work as well. Turn the heating element off in your car seat. If you have one of those fancy cars with a heating element in back, turn it off. Get electrical currents away from your body and use hot, moist heat, not dry heat. Give that heating pad to your worst enemy. It's just terrible. It is holding you back. And if you have sharp or shooting pains, you can use ice from 5 to 20 minutes at least 3 times a day and bring the swelling and inflammation down. And you'll feel better almost instantaneously in most instances. Number 3 bad idea is rest in bed. You're supposed to be active. You can be active safely with most cases of lower back pain. Sitting there, by the way, at the computer terminal rips up the back. It increases discal pressure. It does a lot of harm. Get up, stretch, move about, breathe. Resting in bed or even sitting is terrible for the back, and that's why your back is hurting. Cut that stuff out. Another old idea, chiropractic is dangerous. Medicine is dangerous. Chiropractic is safer than aspirin. You want to go the most natural way first, chiropractic first, then drugs, then surgery, because drugs have side effects. Surgery is dangerous. Go see your medical doctor first. That's idea number 5, that he's most qualified to help you. Doctors of chiropractic have more hours in anatomy and radiology than your ordinary doctor does. There's not a lot to be done about it. That's bad idea number 6. There's a lot that can be done. You could feel better almost instantly with a proper chiropractic adjustment in many instances. Gently realigning the spine could be the best thing for you. You should see the chiropractor first, drugs second, and surgery last. Bad idea number 7. Oh, once you go to the chiropractor, you always have to see the doctor of chiropractic. That is total nonsense. You can stop anytime you like. It's not addictive like medicine. Many people choose chiropractic as a healthy lifestyle. That's something different. But chiropractic is very safe, and you could stop anytime you want. Waiting is dangerous. People think, just wait, the back pain will go away. Well, if it's not going away, you probably want to call my center. I'll give you a number in just a minute. I can't accommodate all of you, of course, but I'll give you a special number that you could call and receive a free examination without obligation. And if you've been told, well, we're going to have to chop on your back, we're going to have to chop out the disc, that could be very dangerous. You want to go the most conservative route first. The best surgeons will tell you get conservative care. Chiropractic represents conservative, safe, gentle, conservative care first. Drugs second, because drugs have side effects, and surgery, but that should be the last thing you want to enter into. It could be 50-50 as far as spinal surgery is concerned. Sometimes after surgery, people are never the same. Sometimes after a surgery, people never walk again. Surgery is dangerous. That's the last thing you want to do. You want to make sure you go through a good course of conservative care before you even think about drugs or surgery. And I think this is the most dangerous idea out there. We start to lie to ourselves. We start thinking, well, I've got back pain, but it's normal for me. I've got the normal back pain. Is that crazy? People say, I've got normal back pain. I've got back pain, but it's normal for me. Who are you trying to convince? Those are crazy ideas, and they're holding you back. And there's an excellent chance, if you start doing the right thing to care for yourself and give up these old antiquated ideas, your back can heal. And if you're not feeling better, give my center a call. The number is 303-394-2273. My name is Dr. Vicentin. Share if you care, like, comment, hit that red subscribe button, and I'll be back with something powerful and positive for you and yours.